Type 2 diabetes, a devastating diagnosis, amputation, heart attack, stroke, kidney failure, a disease that may not kill you right away, but it'll make you wish you were dead. A 60-year-old lady was given such a diagnosis. See what she did next. So, Camille, tell us about this 60-year-old lady with a diagnosis of diabetes.
So she came to our clinic seeking advice and guidance on what she could do to change her diet because she was very scared of this new diagnosis. She knew people in her family who had diabetes and all these serious heart failure, kidney failure, and she also had high cholesterol too. And her primary care started her on a cholesterol-lowering medication, a statin drug, and on metformin, and she was also having fears about the side effects that she was reading for these drugs too.
So it's interesting, a 60-year-old lady with a family history of diabetes and probably heart disease, she may have known about that. So she knew of this threat for a long time, and I imagine it was somewhat haunting her, and all of a sudden she gets this diagnosis. Then of course she gets prescribed medication. Now many people may or may not be aware, heart disease, number one cause of death and illness, and cancer, number two, but medical treatment is the third cause of death and illness in society. So I can imagine how worried she was, and so she came to us wanting a better solution, I imagine. So what did we find on our evaluation?
So her hemoglobin A1C was 6.8. Anything above 6.5 is consistent with diabetes. She had high bad cholesterol called LDL, high levels of inflammation in the body along with that, and she had high lipoprotein(a), which is a molecule that also increases risk of heart attack, stroke, and death. And we know that half of all Americans have diabetes or prediabetes, and then the most prescribed medication in America are the statin drugs for high cholesterol. So that kind of goes to say something about the foods here in America and what we're taught is healthy enough to eat.
Interesting. Here we have a typical patient with diabetes and risk factors for heart disease, given the typical prescription medications. However, she wanted a different approach, and so I think it's worthwhile looking at that approach and comparing it to the standard approach that we take here. So how did we intervene?
So we coordinated with our culinary team and the wellness coaches, and we prescribed our typical plant-based diet. But because she had to travel a lot out of state taking care of a sick family member, she wasn't able to be in Houston with us and take advantage of a lot of the services that we offer. So we gave her a lot of nutritional handouts and recipes and had some phone call coaching sessions to help along the way. But we had to reassess things in 3 months, and she elected not to take the medications during that time. And we were just monitoring her mostly remotely.
So during that 3-month time period, how do you think she did? How well did she comply?
She struggled and had some issues with compliance, being in other environments, being in a hospital environment with a family member where that food is not healthy. And, you know, she did cheat. She had some boudin and shrimp, I do remember. But for the most part, she did stick with a highly raw diet. And she was able to exercise more and still make some progress.
You know, it's interesting you point this out because, you know, oftentimes you have patients in different situations. Many come to our center, they're here, watchful eye and guidance. You know, our nutrition team is preparing food for them every day. There are oftentimes patients who live locally, who get meal plans delivered to them or they pick them up, or a variety of situations where they are able to take advantage of our support services. Now here's a situation where this patient did have some support, but not to the extent that many patients have. And so you're in other environments and you tend to veer from the plan. But apparently there was some element of course correction, which is important. And I just want to point this out because this approach to lifestyle change is one that's very, I should say, challenging. It requires a certain amount of dedication and a certain amount of planning. And this patient didn't have the advantage of using all of those things. Fortunately, with the phone calls and things, she of course corrected. And so it'd be interesting to see how well she did despite these slip-ups. So how did she do?
Well, despite some disadvantages, she lost 19 pounds in 3 months. So she's no longer overweight. Her A1C went down from 6.8 to 6.4. So she went from the diabetic zone to the pre-diabetic zone, and she lowered her bad cholesterol called LDL by 17%, and her inflammation score went down by 9%.
Wow. This is impressive. So here's a situation where you clearly had a patient who wasn't able to follow the program to its maximum extent. She had slip-ups here and there. She was, needless to say, not perfect. However, despite that, she had very powerful results. In fact, these improvements were probably better than she would have had with the medications in most cases. So despite the fact that the nutrition intervention was not done to its full extent, she didn't have a full dose, it was still, in my opinion, superior to the pharmacological intervention. So it goes to show you the power of the intervention. The other thing too, the mindset of the person who keeps trying and working toward getting better always brings about some level of improvement. And so hopefully over time, as she gets over some of these hurdles, maybe family members are no longer an issue after a time, she can optimize and become more compliant and achieve even greater results. But I'm very pleased that we were able to discuss this type of patient, because not everyone's able to do the program perfectly. However, if you do the program to a certain extent, you will get positive results. So for all of you who are out there who may be struggling, keep up the work, keep up the effort, okay? I hope you got a lot out of this. And of course, as usual, with questions or comments, leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.